Hello and welcome to the IND podcast. I'm your host, Dennis Dunicic. Before we begin, I want to remind you to subscribe to our channel. And at the end of the video, like it, comment, and let me know what you think. Now let's get right into our story today, which concerns coronavirus in Singapore, or more specifically, how the small city nation managed to tackle the COVID-19 pandemic successfully and has today more or less managed to reinstitute some significant level of normalcy. Or what I mean by that is pre-pandemic life. Now, we're going to evaluate the entire response to the COVID-19 pandemic since the beginning of the government and country of Singapore. Now, when the pandemic began, Singapore was one of the few rare countries to immediately institute a lockdown and close down its borders. When this lockdown was instituted, Singapore was able to ensure that in the beginning and early days of the pandemic, infection rates stayed in the single or double digits. They were very low. And throughout the pandemic, Singapore managed to maintain very strict restrictions or even lockdowns on their own populations. Now, while this was pretty strict and almost draconian, it did ensure that the spread of the coronavirus was not too intense. However, this year in August, the government of Singapore has completely decided to take a complete turn on how it is reacting to the coronavirus. Basically, life is more or less back to normal, but it should be said that it is a new normal. Shops are open, restaurants are open, movie theaters are open. Life is open. People can go out, enjoy social events, can go out and eat, can go out and shop, which is really important. Singapore is an extremely wealthy nation and has a lot of very heavy consumers. Consumerism is very important, and the people of Singapore can partake in this. And despite lifting its lockdown, which many experts criticized the government before doing so, stating that the lifting of the lockdown or the lifting of any restrictions in August would lead to a major spike in coronavirus infections. That did not happen. While infections did increase of the coronavirus, generally speaking, and especially when the Delta variant came in September, Singapore, more or less, was able to see a decrease and decline in daily infections, especially in this current month. Now, while there were significant spikes during the Delta surge in Singapore in September, this month, average infection rates are actually, and especially this week, have been less than 1,000 people, which is not a lot for a country that has 5.5 million people in its population. Now, many people ask the question, how has Singapore managed to completely open up its economy, bring life back to relative normalcy without experiencing a major surge of infections? The reality is Singapore, unlike many other nations, has a massive vaccination rate. Currently speaking, 94% of all eligible individuals in Singapore have received vaccinations. And not just a single dose. They have received both doses, 94%. That is an astronomically high vaccination rate. In addition to this, 26% of all eligible adults have received their booster shots. And even while the virus has managed to spread, especially during the Delta variant in September, 99% of recorded COVID cases during this surge have only had mild and less than severe symptoms, meaning that only 1% of coronavirus cases were serious, and even less led to fatal results or death. And the people that did die of coronavirus during the Delta surge in September were actually individuals who were unvaccinated or had long-term health issues and were older. Now, I'm not saying these are people that were going to die anyway. However, statistically speaking, these were not people that were healthy, vaccinated, or young, like the majority of Singapore's population. In addition to this, Singapore's reaction to the coronavirus looks even more successful when you compare it to other countries. Now, we can go out and compare this to every other nation on earth, and we can compare it to some nations that have vaccination rates as low as 7%, either because they don't have access or equity to vaccines like many nations in Africa, or because a lot of people simply believe in anti-vax sentiment like many nations in Eastern Europe. But let's not do that. Let's actually look at another country that's right next door to Singapore, Malaysia. Now, Malaysia was this year experiencing a Delta surge, just like Singapore. And during the Delta surge, Malaysia was experiencing an average of 12.27 deaths per 1 million people a day. Now, during the same surge in Singapore, it was around 2.57 deaths per day. So on average, Malaysia was having 10 more deaths per 1 million people. So we're looking at it per capita on a daily basis than Singapore was. Now, the reason for this is Malaysia's vaccine drive and vaccine efforts have not been as strong as Singapore's, at least at the time. And for good reason. Malaysia is a much larger country. Singapore has a population of 5.5 million people, while Malaysia has a population of 35.5 million people. It's a significantly larger population, meaning that logistically it is more difficult to spread vaccines and have vaccine drives. Nonetheless, the Delta surge and increase in infections caused the Malaysian government to go on a serious vaccine drive and vaccine mandate. And today, 80% of adults in Malaysia are vaccinated. And just like Singapore, their rates of infection have dropped and rates of death have become almost abysmally low, which is a really good thing. Basically, the entire purpose of this report is to see what's happening in Singapore and how that can be applied to the rest of the world. Now, the current Singaporean model is really simple. The theoretical eradication or prevention, or the idea that we can completely get rid of COVID-19 and we can get to 0 cases, is impossible. The government and health officials of Singapore have openly stated that they view the COVID-19 pandemic as endemic, meaning that it is going to be continuous, it is going to happen. Where there are people, there will be COVID-19. Basically, in Singapore, coronavirus has begun to be treated like the flu or the common cold. It's just something you're going to get. But the reality is, because of the nation's very high vaccination rate, people that do get infected with coronavirus are most likely vaccinated. And they are very, very unlikely to develop severe symptoms. Only minor symptoms like coughing or sneezing or a light fever, which are not fundamentally dangerous. And in addition to that, do not create an overflow of patients on medical systems. Now, when it comes to any pandemic, there are 2 logistical things that any country wants to or needs to protect. One is the health system, ensuring that there are not too many patients in the hospital to the point where hospitals cannot take care of everyone and have to begin triaging and determining who they're going to give or not give care to. Number 2, what obviously needs to be avoided is death. And vaccinations in Singapore and the open approach that Singapore has had has shown that vaccines are very effective at preventing severe symptoms, hospital overflows, and death. So how did Singapore manage to get such a high vaccination rate? It's really simple. They made it, 1, very, very easy to get vaccinated, eliminating pretty much any barrier or border for vaccination. Anyone that wanted one could easily get one. 2, they made life very, very, very difficult for people that choose to go or do not get vaccinated. They made life for unvaccinated people more difficult. And that sounds harsh, and it is, but it's less harsh than a lockdown, than closed borders, than a completely shut down economy, than a lack of freedom. Many people who are anti-vaxxers are stating an argument for freedom, but the reality is in countries where vaccination rates are higher, where people are inoculated, there are more freedoms. There are less lockdowns and there are less restrictions. Vaccines fundamentally mean freedom. If you believe in freedom, the best thing you can do is go and get vaccinated. Now, I personally do not believe in forcing anyone to get inoculated, and the Singaporean government has more or less, well, not officially, created a vaccine mandate, has more or less de facto made life so difficult for people choosing not to get vaccinated that they had to get vaccinated, making it so they could not enter basic convenience stores, enter shopping centers, enter malls, or enter government buildings. These people needed to get vaccinated. And that's why Singapore now has a vaccination rate of 94%. Now, finally, it should be stated that even this kind of push was not necessary because, generally speaking, the level of trust in the government in Singapore amongst the people is very high. And there is a huge correlation between level of government trust and vaccination rates. In countries where people tend to trust the government or believe that the government is working genuinely or generally speaking in their interest. Now, it's always good to have an unhealthy distrust of the government, but what I'm talking about is a general trust that their governments are working in the interest of the people. Vaccination rates are higher. And that's why Singapore was able to achieve this. Now, obviously, trust in the government is higher because people in Singapore live relatively good lives. It is one of the world's wealthiest nations and has one of the best qualities of life. People trust the government. They tend not to really care about politics too much because it doesn't affect their personal lives. And everyone kind of has a functional future and kind of a happy and satisfying quality of life, which is more difficult to implement in countries that don't have that. But nonetheless, the lesson that can be taken from Singapore is make access to vaccines easier and make the choice of not getting vaccinated more difficult to make. Because we all want to get back to normal. We all want to see the markets open. We all want to see the stores open. We all want to see the theaters continue to be open. Now, most of the world currently is not under a lockdown, but a new variant, Omicron, which we covered yesterday, has arisen. Not much is known about this virus. I did a report on it yesterday, and nothing has changed. Again, still not much is known on this virus, if it's more deadly, if it's more dangerous, but the reality is more variants will probably continue to eventually arise. And if we don't have high vaccination rates, we could find ourselves in any country in the world experiencing lockdowns. And lockdowns are bad for the economy, they're bad for mental health, they're bad for social order, they're just all around bad. And the way to avoid this is to do what Singapore did. Get vaccinated. And I mean this on a personal level. To everyone viewing this, I encourage you to get vaccinated. On a governmental level, for nations, it should be encouraged, or they should take approaches which encourage people to get vaccinated and discourage people to not get vaccinated. Now, I want to end this story on one really, really good note. In addition to lifting many restrictions in Singapore, the government of Singapore has done one very major has lifted one major restriction that is also symbolic. They have partially, not fully, but partially opened the Causeway Bridge, which is the bridge connecting Singapore to the peninsula of Malaysia and much of Asia. This bridge is a major source of traffic where people go in and out between nations on a daily basis. And it has been closed since the beginning of the pandemic. This bridge has been closed for 2 years and it is open again. That is a major success and a major victory. And every other country, if it can get its vaccination processes and its vaccination programs together and to be just as effective as Singapore's has, can have just as much success. Now, I do want to end this report on a cautious note. Singaporean Prime Minister Lee Hsien Loong did state today that the appearance of Omicron is a cause of concern. Singapore probably will not be having more lockdowns or restrictions, but the Prime Minister has stated that if the Omicron variant presents a threat inside Singapore, that some steps backwards will need to be taken before more steps forward can be taken, meaning that more lockdowns or more restrictions can come if the variant is not controlled and contained. But based on how Singapore was able to successfully meet the Delta variant, because of its high rate of vaccination, Omicron probably will not present a problem. And on a final note, it isn't just vaccinations that are saving Singapore. It's mask mandates, it's social distancing, and finally, it's testing. Singapore, since the beginning of the pandemic, has been one of the most effective nations at testing and tracking where virus outbreaks come from, pinpointing exactly where outbreaks come from and being able to contain it. These kinds of approaches, vaccinations, safety measures, masks, social distancing, testing and tracking, are the solution to learn how to live with the virus. The eradication or the end of corona is never going to happen, probably. Most likely. Corona is going to continue to live with us, and we're going to have to learn how to live with it. We have the tools to do so. Now, the only thing that's left to do is to properly implement them. Thanks for tuning in today. Before you leave, let me know what you think in the comments section. And let's have a good, nice debate, conversation, or talk about what's going on with coronavirus in Singapore and all over the world. This is not just a story about Singapore. It's a story about how the world can take the Singaporean model and apply it to itself to fight this global pandemic. Thanks for tuning in, and I'll see you next time.